Dr. Bachir Younes giving you an update on the coronavirus pandemic. Today is Monday, March 31st. I just finished being on call for the weekend where I admitted 16 patients, 12 of which had coronavirus. And unfortunately, I lost a patient to COVID-19. Few of the patients have been admitted to the ICU. Our hospital is inland in California, in the Palm Springs area, so we are not one of the biggest hit areas yet. The biggest difference between what is happening in the United States compared to China and what is happening in Europe, especially Italy and Spain compared to China, is the huge amount of patients who are getting infected. Thinking about this, China has at least 3.5 times the population of the United States and 10 times the population of Italy, and yet they were able to maintain the infection numbers to 81,000 infected patients. The last I checked, we have 185,000 cases in the US and over 110,000 in Italy. The main difference between the way we protect ourselves in the US, in Italy, compared to China is this. Masks, which don't have to be surgical masks for the purpose of protecting the individual, they can be simply made at home with a piece of cloth, a piece of linen, and any string to tie around your head. I recommend personally, this is not coming from major sources, the CDC or the NIH or anything like that, but I recommend you wear a mask anytime you're out in public. If you're going to the supermarket or if you're going to work, if you have to go to work, please wear a mask. If you've ever been to China or to Japan, you see that one of the main ways that people protect themselves is by wearing a mask. Almost all the population does wear a mask when they are in public. Wearing masks has been studied in previous viral pandemics, and it has not shown to be efficacious or cost-effective. However, we must remember that COVID-19 is nothing like we've ever seen before. The infectivity rate is much higher than even influenza. One patient who has influenza has the potential to transmit the infection to one patient. However, with COVID-19, one patient transmits it to 3 patients. And so the infectivity rate is much higher. We must do things that are not usual to try and prevent the spread. If you have a viral infection, whether you're cold or flu or COVID-19, and you wear a mask, the particulates that have the infecting organism, the virus, basically stay inside the mask. So the potential to transmit this virus to other people goes down significantly. At the same time, if everyone wears a mask, then their potential to transmit any kind of virus to you, including the COVID-19, is also extremely low.